Good evening. I will call to order the September 21st, 2021 Board of Directors meeting for PCCS to order. The mission of Piedmont Community Charter School. Piedmont Community Charter School is a tuition-free K-12 school that offers a superior college preparatory education experience for this community and its families. If you'll join with me in a moment of silence. Thank you. Before we get into public comments, I would like to propose that we have a couple agenda changes. Steve Eaton is going to give us a presentation on the current state in Gaston County as far as COVID's concerned via Zoom. And so I'd like to add him after public comments. And then directly after that, I'd like to put 6F, Governance Committee report, right after that before awards and recognition. Do I hear a motion?
Make a motion that we move Steve's presentation to after public comment, and then item report 6F right after that.
Second.
Motion to second. All those in favor?
Aye.
All those opposed? Motion carries. Thank you. Okay, public comments. First person signed up for public comments, Bradley Crawford, Bessemer City. A reminder to everyone, please put your street address, city, state, and zip on the public comment sign-up sheet. Bradley Crawford, yes, sir.
I'm here on behalf of my children in the mass.
You can use the mic up front here.
All right.
Yep. Thank you. Good.
I'm here on behalf of our children and the mask mandate. As adults, we're supposed to ease the fears of our children. Instead, we're scaring them into believing they are the monsters that need the mask. Every day, our children see movies, television shows, YouTube, college sports, professional sports, going to grocery stores and restaurants, and they're the only ones that have to come in and wear masks. At school. So why do we continue to allow this? Have any of you thought about the psychological effects of these masks, short and long term? Every day these children have masks on, it makes them hard to breathe. It makes them hard for them to develop linguistic skills and pick up on social cues by hiding lips and muffling speech. Mask also prevents the hearing impaired from lip reading. People rely heavily on facial expressions. Without facial expressions, children and even adults often misinterpret one another. We're teaching our children to be afraid of their peers and themselves. Children are developing an unhealthy worry that they're going to get someone sick. Time after time, I keep reading that anxiety and depression levels in our children continue to rise, which causes them to withdraw from any sort of social interaction. There have been more COVID suicide deaths. There have been more COVID suicides than COVID deaths in children. I have spoken to several teachers, and behavioral issues continue to be on the rise. Children often express anxiety and fears through their behavior. These issues need to be taken into consideration when voting on this mask requirement. Not only the psychological effects, but the physical effects need to be considered. Our bodies expel waste through exhalation. Now we're making our children hold on to this waste against their face and their nose all day. Several times my children have come home with headaches, and I can only attribute it to masks. As parents, teachers, and board members, we have got to start making better decisions about our children's future. I understand the pressure from the community leaders and politicians that masks must be worn. This should be a parent's decision based on the knowledge of our children. As the community of parents, teachers, board members, we can make that decision as to what is best for our children. We do not have to comply to pressure. If these people were that concerned about society's health, why are cigarettes still sold? Alcohol remains on the shelf. Not only society, though, but if they were concerned about our children's health, then why are there so many foods loaded with sugar, steroids, and hormones on our grocery store shelves? I understand that there are some children and adults that would feel safer with a mask on, please encourage them to do so. But this should be a choice. I urge you to think about the negative effects of these masks that are having on our children. Please vote no on this mask mandate. Thank you.
Thank you. Auburn Kelm, is that correct?
Hi, my name's Auburn Kelm. I'm a 7th grader at PCCS at the middle school campus. I know you aren't expecting a 7th grader to come in front of you. Masks have not hindered my learning. It has not hindered my ability to make friends, be taught, or laugh. I think we should keep wearing masks because it is an easy way to protect ourselves during this pandemic. Please consider keeping the mandate as is. Thank you.
Thank you. Heather Cattell.
Hello, my name's Heather Catlett. I am a parent of 3 students, one in 2nd grade, one in 4th grade, and one in 6th grade. I'm also a healthcare worker in the acute care setting for several Atrium Health facilities. So last time, somebody mentioned that there were no numbers. I'm going to give you Gaston County numbers. 35,481 positives, 517 deaths, 17.7% conversion rate. North Carolina overall has an 11% conversion average. Gaston County rate is 90 cases per day per 100,000 people. Mecklenburg County is at a rate of only 50 per day per 100,000 people. North Carolina rate is 66 cases per day per 100,000, and the U.S. daily rate is 46 per day per 100,000. Again, let me say Gaston County is at 90 per day per 100,000 students, or per 100,000 people. Let me give you my numbers for my hospital. So today, our census was 170, and 70 of those patients are COVID positive. At my secondary facility, our census was 55, and 12 of those are COVID positive patients. Currently, my ICU is double bunking beds because of the severity of this. Every patient in our ICU is vented. In addition, today, effective immediately, as an Atrium Health employee, I am now being required to serve at patients who hospital at home. That means that we've deferred so many patients because of our numbers that I will now also be mandated to go into their homes and serve them in their homes. This is far worse than what it was last January at the top of our numbers, and I'm asking and pleading that at this point we continue this mask mandate. I don't like wearing a mask. I will be the first to say I don't like wearing a mask. I cannot wait to walk around and see people's faces. I'm a speech pathologist, so articulation is a huge thing. I know that was something else that was brought up last time as well, is how can we articulate under a mask? I have to wear a respirator. It vibrates on the sides. I get so much auto feedback from that it's hard for me to talk. I have to wear gowns and gloves and everything else. I know you work in a school, and this is not what you signed up to do, but please believe me when I say 13 years ago when I started this career, this is not what I signed up for either. I don't like being in this position. I don't like that our county is in this position, and I don't like that our kids are in this position. I don't want my kids to wear masks either, except for right now, because it's currently that bad that I feel like we have to protect our kids. My kids have worn a mask every day. They don't complain, they just do it. They do it because they see what I go through. I can't walk out of work and hug my kids when I pick them up from school anymore. I can't, because I'm covered in germs that are not my own. I'm covered in something that I would never wish anyone. Do you know what my number is? 372. That's how many families I have FaceTimed. That's how many patients I have lost this year at my facility or personally known. That's a high number. I don't wish that on anybody.
Thank you.
Please carefully consider wearing masks for our children. Revisit it. I'm happy to revisit it every time. I'm happy to present numbers every time, but please carefully consider wearing masks again.
Thank you. Jonathan Roberto.
First of all, I want to congratulate this school for making it through the first month with as little interruption as we possibly could. As you can tell just from what she said and what my own experiences in working in a nursing home, COVID is here. It's not going anywhere at this point. The best we can do is try to protect ourselves as much as possible, and so far we have done what we have set out to do with this mask mandate for the first 30 days, and we've limited the amount of people that are out of school. Yes, there have been positives. There's nothing we can do about that, but the amount of spread that has happened because of following the mask mandate and quarantining appropriately has done its job, and it needs to continue on beyond this point to continue on to the next level. Thank you.
Thank you. Josh Walker.
I spoke at your last meeting, and I just want to reiterate some points that I said last time. The masks don't work. N95 masks work, but I don't see anybody wearing one. We keep hearing these really scary statistics of how many people are getting infected, how many people are dying. How many lives are actually being saved by T-shirts on our face? I've not seen any reports. For 18 months plus, that's all we've had is scare tactics. We go to church, we go to work, we go to the grocery store, we go to softball games, we go to dance. All these things, and masks aren't required. Children are the absolute lowest risk of a COVID death. The cold and flu is just as severe as COVID to our children. We have the vaccine. We have 70% vaccinations. I've been fully vaccinated, Moderna, since April. So I just want to reiterate again that wearing a piece of cloth on our face all day is doing nothing but hindering our children's education. Thank you.
Thank you. Shannon Alexander.
How you doing? Thank you for giving me the opportunity to speak. Says, I did a survey and asked parents with high school age children why Piedmont was or was not their choice of school. The response I received that was 8 out of 10 parents believed that they knew how their child would be treated and how this treatment would constitute a hostile learning environment. I see and hear constant reference to the word diversity. Diversity is not equality. Simply being present without a voice is an issue. As I look at the board, I wonder, no response is a response. The board turning a blind eye to racial bias, prejudice, and ill treatment is the issue. We chose this school for educational opportunity. My child is entitled to as much as a resident of this community and a citizen. Our children should not have to question their purpose, their race, or heritage to be deemed acceptable to attend this school. For instance, the tools we use to groom our natural hair cannot and should not be deemed as a weapon. If similar tools used for other textures of hair aren't. Our children should not have to be docile in order to be good students and have self-defense. Should not be punishable. We send our children to school to learn from what should be unbiased educators and staff. We deserve to be treated with the same respect as parents. Racism is a community issue, and if it's not the community issue, we're all an issue. We're all aware that change can happen simply in schools. Ruby Bridges could have went to another school as well. Thank you for my time.
Thank you. Sean Rayburn.
guys doing? So on Tuesday of last week, I held my kid out of school, Kyle. He missed 4 days. He had sniffles, and we just didn't. We knew that it would be a distraction. We knew that it would be something that would cause for concern, and we went and got him tested. We had no fever, no cough. He just had the sniffles. We held him at home for 4 days. I doubt he got anything done. It was a major hassle scheduling a test. We got him tested. Luckily, he was negative. And fortunately, I'm in a situation where I can stay at home and I can work from home and he can do remote learning, but I know that there are a lot of people that are not in that same situation. It absolutely ruins my efficiency at work. It ruined my effectiveness at work. I absolutely need that little kid at school. So, I think we need to be honest, though. How many people would have sent Kyle to school with just sniffles? How many people would have just sent their kid to school with just sniffles? How many people that may have not be in a role where they are fortunate enough to work from home or to take time off to go have their kid tested would have just sent their kid to school? And on Monday I get a letter about his unexcused absences. We need to make sure that we let people know that we held him out of school for that. Bottom line, we need to keep these kids in school. We saw what happened in Union County. It was a mess. I have a personal friend, personal friends, Matt and Barbara Jenkins of Union County. Their daughter Alyssa turned 12 a few weeks ago, right after Labor Day, and she got COVID the week she turned 12. She couldn't get vaccinated. Masks were not required at her school in Union County. She ended up getting airlifted to Levine in Charlotte. She was in very, very bad shape. She almost didn't make it. Fortunately, she made it out after about 2 weeks, just 2 days ago. And now her mom's in the hospital with COVID, which is not cool. Matt is not looking forward to the bill. He's a truck driver. He doesn't have great insurance, and I bet he was wishing Union County was mandating masks. I hear a lot of the talking points, fear. Like putting masks on is not addressing fear. My wife was a substitute teacher at PCCS when there was an active shooter drill. She didn't have the key to the door. She didn't know it was a drill, and she pinned herself against the door, thinking that there was something actually bad going on during that drill. That's fear. Like wearing a mask because you're afraid of getting sick of a disease that's killing millions of people. That's also fear, but it's a different kind of fear. It's not, putting on a mask is not fear. Psychological effects, yeah, it stinks, but having a student or a teacher, a classmate die, that's pretty bad effects as well. Hard to breathe, sure. Surgeons don't have problems breathing in masks. I fear the other 194 countries, a majority of which have much lower rates of transmission, 20% of what we have. We have 5 times more than everywhere else because they didn't make it a political issue. They're going to be supplying us with our surgeons because we have made it to where we have a generation of kids that are afraid of wearing masks.
Please wrap it up, sir.
Yes, sir. I offer one concession. Last year, the drama program for Adam's family, they had these face shields so they could see the faces during the presentations. If we're not going to have the cloth masks or N95s or whatever mandated, we could probably look at an alternative like a face shield or something like that.
Thank you. All right, so just a reminder that comments are limited to 3 minutes, so try to keep it to 3 minutes. And also, while you're on school property, you have to follow school rules. Right now, we have a mask requirement policy at the school. There are masks available outside. We appreciate you following the guidelines if you're going to be on school property. Thank you, sir. Okay, so now, Ms. Largent, would you like to introduce Steve for us?
Sure. It is my pleasure to introduce Steve Eaton, the Public Health Director of Gaston County. He is going to give us some detail tonight about the current state of COVID in Gaston County. Mr. Steve Eaton.
Great. Thank you, Lisa, for that wonderful introduction. And thank you all for having me this evening. I'm going to probably try the hardest thing tonight, and that's to share my screen. So let's see if I can give this a go. Great. Are you all able to see that?
Yep.
Okay, wonderful. Great. Good evening, Chairman Poole, members of the board, and Mrs. Killian. Thank you for having me this evening. I'm very appreciative that you all are keeping the science and data central in your decision-making during this very difficult time as we move through this pandemic with what I really truly feel is a common goal between you all and public health, and that is to keep all students and staff healthy and safe in school, in person. You all should be commended, your staff, your custodians, and everyone in your faculty, and most importantly, your students for all that you're doing during this pandemic. So what I want to do tonight is do two things. One is to provide you all with the current COVID metrics for Gaston County, and then we'll take a look at school age data for Gaston County citizens. So all the data that you're going to see tonight is specific for Gaston County. So let's get started with daily new cases. With regards to the daily number of new cases, you'll see here that we are currently in the highest surge of the pandemic since the peak in January. The thin blue line that you see jumping up and down are the daily reported cases, and the thick red line that you see is the rolling 7-day average. At the end of July, just a few months ago, we could count on one hand the number of daily new cases. Some days we had 2 or 3 daily new cases. Right now, we're averaging 210 per day. This surge in cases is due, as we know, to the highly contagious Delta variant that has taken hold in our community and our state, along with our very low vaccination rate in Gaston County. You'll see that there's beginning to be a slight downward trend in the number of daily new cases, and we certainly hope this trend continues. Let's look now at the positivity rate for Gaston County. The positivity rate refers to the total number of tests that are positive in relation to the total number tested. Our current positivity rate in Gaston County is 17.1%, which puts Gaston County in the highest category in North Carolina. A high positivity rate shows a greater penetration of the virus in our community, along with a generally very strong community transmission. Ideally, we would like to see our positivity rate around 5% or less. Again, when we look back just a few months ago at the end of July, our positivity rate was a little less than 3%, and now we're back to 17%. When we look at hospitalization, and this is for our area hospitals, and these are Gaston County citizens that are hospitalized on this graph. So this is not hospitals in general. This is Gaston County citizen specific. This is obviously a very concerning trend. When we look at the numbers of those being hospitalized for COVID, you can see the acceleration rate in that where that peak began in July. So you'll see that the peak that we experienced in January, while it was nearly equally as high, it was a slower climb. The steepness of the curve is what a lot of your healthcare professionals in public comment were speaking to, is that dramatic increase that we're seeing. When we see a sustained high number of new positives and a high positivity rate, we know that hospitalizations are going to increase shortly thereafter, and that's what we're seeing here. While we have surpassed the highest number of Gaston County citizens hospitalized, again, we're beginning to see a slight downward trend in those being hospitalized. This slide shows you those three trends on one slide. First, in the green, you'll see the day over day of new cases since August of 2020. In yellow, you'll see the average number of citizens hospitalized. And then the red line, you'll see the number of deaths. This increase in recent mortality is extremely concerning. Gaston County, unfortunately, had 16 citizens pass away over just this last weekend, and over 63 in the last month. As of today, we have 528 Gaston County citizens who've lost their lives to COVID. And certainly our thoughts and prayers go out to their families and friends. So let's look more specifically at the school age cases and contacts. And again, I just will reiterate that the numbers that you'll see here are for public, private, and charter schools combined. We don't break it out. We look at it as a age group. On this slide, we're going to look at the weekly cases of ages 4 to 18. This slide shows you the number of weekly COVID positive cases in Gaston County for this population. As you can see here, the school age population, the number of daily new cases remains extremely high, close to, if not in the previous weeks, exceeding our January numbers. The average of daily new pediatric cases is nearly 4 times what it was the week ending July 24th of 2021. The encouraging sign is, again, we saw a slight decrease in pediatric cases last week. When comparing July to August, you can see that Gaston County has experienced an increase in new positives, an increase in new school-age positives, and the percentage of school-age children as a percentage of total cases is increasing dramatically, and that's that red line that you'll see. In July, pediatric cases made up 15% of all new cases, and currently pediatric cases make up more than 25% of all new cases in Gaston County. When we look at student exposures and quarantines, again, this data is specific for all schools in Gaston County. You'll see that there was 81 exposures or quarantines the week end of August 27, 1,301 the week ending September 3rd, and 1,507 the week end of September 10. When you compare this to schools that were mentioned earlier that have no indoor mask mandate, it's a fraction of those schools. It's significantly less students who are being held out of school based on exposures and quarantining. The areas in school populations where our CD nurses are determining most exposures are coming from are in areas where obviously students are needing to eat without masks, and then also athletic events like practices, games, locker rooms, and different training efforts. With regards to faculty and staff cases, again, this is for all Gaston County schools. On this slide, you'll see both staff cases and staff exposures side by side over the last few weeks. In the green, you'll see positive cases of staff and faculty, and in the gray, you'll see those who were exposed and had to thereby quarantine. As you can see, for the week ending September 10, the number of faculty testing positive nearly doubled. Gaston County continues to lag significantly behind the state average for vaccination among the 12 to 17-year-old population. In North Carolina, 38% of 12 to 17-year-olds are fully vaccinated, compared to 25% in Gaston County. And I will just pause here for a disclaimer that the vaccines are widely available in Gaston County and extremely easily accessible in nearly all pharmacies, physicians' offices, and our health department offers vaccines Monday through Friday, 8 to 5, no appointment necessary, and you can choose the vaccine of your choice. We often get questions about pediatric hospitalizations. So I wanted to show you these numbers. When we look at the number of children hospitalized due to COVID, you'll see that Gaston County has had a few children hospitalized, most months dating back to June of 2020, with the highest number being February 2021 with 7 hospitalized. And in September, we have had 3 hospitalized pediatric cases. Lastly, I wanted to compare for you where we were last August as to where we are this August. Last August, we averaged 44 daily new cases. Today, we're averaging 210 cases per day. On average, last year at this time, we had 5 youth ages 4 to 18 testing positive. Today, we're seeing an average of 49 testing positive each day. Our positivity rate last year for Gaston County was 7.95%, and as of now, it's 17%. And the average COVID census of Gaston County citizens hospitalized was 29 last year, and currently it's 117. Therefore, our public health recommendation remains the same. That's to require all children and staff to wear face coverings when indoors, require passengers and staff on buses, vans, and other school transportation to continue wearing face coverings per the CDC's order, ensure that face coverings are worn indoor by all individuals not vaccinated, grades 9 through 12, workers, teachers, guests, and adults. And this recommendation is based on a few things. Our extremely low vaccination rate as a county. We are only 49% fully vaccinated in Gaston County. And also because of the local spread of the highly transmissible Delta variant and our very high increase in positivity rate and daily new cases. So with that, I will turn it back over to you, Chairman Poole.
Thank you, Mr. Eden. We appreciate that. Thank you for zooming in here and sharing that information with us. I apologize to you all in the audience for not having that. Hopefully you got the gist of it. If you didn't, you can go back and watch the video on Facebook, or you can go and watch the Gaston County Schools meeting last night. I think it's around the hour 26 mark. You can pick up on Mr. Eaton's presentation there and catch up on that data. So can you hang around for a few questions?
Yes, sir.
Great. Does anybody have any questions before we move on to the governance report? Okay, Ms. Crawford.
All righty. Thank you. Okay, so as the governor, chair of the governance committee, in response to the Senate Bill 654, the board of directors must have a face covering policy. We met with Ms. Gillen met with our attorney David Costello, who had drawn up the policy. We went over it in the governance committee meeting on September 14, 2021. The bill requires that we develop a policy, and it must be voted on by the board each month. The bill reads as such. COVID-19 interim safety measures policy. During the COVID-19 pandemic, the board and the school administration will establish and enforce necessary precautions and mandates to protect the school community based on developing conditions and existing rules and health requirements and guidelines. At least monthly, the board will review current conditions, rules, and guidelines and update this policy accordingly. The administration will communicate all updates to the school community and post the policy as updated on the school website. Face masks. All persons presented on campus and at school activities, including students, staff, visitors, volunteers, etc., must wear adequate face coverings as follows. Inside of school facilities, except when removal is necessary, e.g. to eat, for medications or medical needs, when traveling on any school bus, when participating in any other school activity, subject to other requirements established by the board or administration. Enforcement. The administration will enforce these and all related safety requirements and shall apply all reasonable measures necessary. Any person not complying with such requirements may be asked to leave the school premises or activity promptly. If the person is a student or staff person, that person may be subject to disciplinary action. Any questions on that?
So this is the current policy. This is what we've been going by pretty much. I mean, this encapsulates it pretty well.
Put it in the policy.
Yeah, but because of the bill, we have to make it official, and then every month, at least every month. So it'll be an item on the agenda every month that will come in, and we will vote to continue to approve the policy or to change the policy. Correct?
Exactly.
Okay. Okay, so we're going to do that now. Any other discussion about the current policy?
question.
Yep.
Moving forward, since we will have to revisit this every month, do we plan to have Steve come back and do a presentation of where we're at,
We can ask him.
like each
Yep.
time? That way
Yep.
we kind of have a basis of what we're,
Yeah, I would plan to ask him, or at least have some sort of information to share, yeah.
yeah, maybe if it's not him actually presenting, but like this packet was helpful,
Yeah.
like just the information.
Yeah, for sure.
Dylan does send out those numbers.
Sure, yeah, we could go off the Friday emails too. Okay.
Should we keep going, or are we having a problem? Do what? Oh, okay.
Do you want me to say it over?
Yeah, Ms. Cass, she calls you.
Okay.
So we'll go back, is that okay, Mr. Fuller?
Oh,
Go
yeah,
back to her
definitely.
question?
Yes.
My apologies. Oh, that does sound louder. I'm a loud person. I'm sorry, I didn't even realize it wasn't on. Well, thanks to Miss Killen, right? She's at home sick and still thinking about it. Okay, so since my mic was not on, I would like to restate in response to the Senate Bill 654, the Board of Directors must have a face covering policy. Our attorney, David Hostetler, has drawn up a policy. We went over the policy in our Governance Committee meeting on September 14, 2021. The bill requires that we develop the policy, and it must be voted on by the board each month. The bill reads as such. The policy reads as such, sorry. COVID-19 interim safety measures policy. During the COVID-19 pandemic, the board and the school administration will establish and enforce necessary precautions and mandates to protect the school community based on developing conditions and existing rules and health requirements and guidelines. At least monthly, the board will review current conditions, rules, and guidelines and update this policy accordingly. The administration will communicate all updates to the school community and post the policy as updated on the school website. Face masks, all persons present on campus and at school activities, including students, staff, visitors, volunteers, etc., must wear adequate face covering as follows. Inside all school facilities, except when removal is necessary, e.g. to eat, for medication or medical needs. Number 2, when traveling on any school bus. Number 3, when participating in any other school activity subject to other requirements established by the board or administration. Enforcement. The administration will enforce these and all related safety requirements and shall apply all reasonable measures necessary. Any person not complying with such requirements may be asked to leave the school premises or activity promptly. If the person is a student or staff person, that person may be subject to disciplinary action. So that is the policy as of this month.
Thank you. So I think my comments came through. I'm glad that you didn't read the whole bill.
Me too.
That would have taken a while. It would have been a flashback to a few months ago.
Oh, yes.
So, all right, is there any further discussion on it? We talked about getting information every month and making sure that we all either have a packet or, have a presentation. Any other discussion or debate? So when we vote, the motion needs to be that we approve, as presented, the COVID-19 interim safety measures policy until the next board meeting, the October board meeting. And a vote in the affirmative will be to approve it. And in the negative, we'd have to go back and figure out what we'd have to get a new policy. There's no further debate. Do I hear a motion?
I move that we accept the COVID-19 interim safety measures policy until next month's meeting.
Do I hear a second? Ms. Malden, second. All those in favor?
Aye.
All those opposed? Motion carries unanimously. All right, next item on the agenda. Was that all you had, Ms. Crawford?
That's all I
Thank you
have.
very much. Awards and recognition. Ms. White, thank you for being here.
You're welcome. Thank you. I would say the only award and recognition that we have today is a huge one. Our entire admin staff wants to thank each and every single one of our staff members for everything that they have done since school has started. All of the hard work that they are putting into their jobs every moment of the day, whether they're at school or even at home. They are going above and beyond to educate our students and to keep everybody safe. So we certainly appreciate them and want to recognize them for everything they're doing. Thank you.
Thank you. Approval of previous minutes. They're in your packet. If you didn't get a chance to look over them, I did just notice one small correction. Greeley to Greenman, right before item 6A was covered. Here you go.
Thanks.
Just right there.
Oh, sure.
Was there anything else? Did you catch that one?
I did. It's on the back also.
Okay.
Oh.
Must have been auto-corrected.
It's
or
Greeley
something.
instead of Greenman. The first paragraph on the back. I've been called worse.
Oh, yeah.
Yeah. Me too. Any other corrections or comments on the minutes? Not hearing any. Do I hear a motion?
I move that we accept the previous month's minutes with the corrections that we've made for the name change. Second.
Motion and a second. All those in favor?
Aye.
Aye.
All those opposed? All right, the minutes are approved. Item 6A, Treasurer Finance Committee. Mark's not with us tonight. Excuse me, Mr. Stevens is not with us tonight. Ms. Wilson is filling in. He usually looks to you for the answers anyway, right?
Okay, so we will start with the board budget report. Total revenues for the month of August were $1,427,012.28, and total expenses for the month of August were $1,100,422.43. There were no changes to the budget this month, so we're still projecting a year-end surplus of $567,152.72. Any questions on that report? Okay. So next is the surplus and cash report. Our operating account at BB&T had $2,807,408.01. Special funds account also at BB&T had $14,804.78. Our investment account at PNC was valued at $2,015,276.31. Our IDA account, also at BB&T, had $56,579.80, and petty cash was at $1,000, bringing our total cash and investments at August 31st to $4,895,068.90. So moving down the sheet, our total cash and investments on hand at 6/30/2021 were $4,804,366. Add in the current year budgeted surplus at $567,152.72, and then back out the fund balance appropriations that we'll be using for various projects at $800,135. And that gives us an expected cash and investments on hand next June 30th, 2022, of $4,571,383.72. And then if you take out the amount that's currently in the investment account, that gives us an expected cash available next June 30th of $2,556,107.41. Any questions on that? Okay, and the last report is for the bonds that we have at U.S. Bank, the bond loan. So the bond fund currently has $298,440.57 in it. The debt service reserve fund is at $1,794,014.99. And the project fund is down to $215,437.37. So total amount held at U.S. Bank as of August 31st was $2,307,892.88. Any questions about any of those?
Thank you. Does any of that need approval, or we're good? Thank you. B, Head of School Report. Ms. White?
Thank you. So the first page that you will have for under the Head of School Report is our compliance submission report. And you can see that we submitted our insurance certificate of compliance. It was due September 28th, and we submitted that on September 27th. And that's all that was needed to be done there. The next two packets that you have together are a culmination of several things. The Executive Committee met on September 19th to approve our social emotional learning plan. Amber Morris, our school social worker, she worked very hard getting this together along with the social emotional learning team to make sure that we could submit this, and they submitted it on September 15th. So it's the plan here and then the suicide prevention manual. They both go together. Next report is the enrollment report. This is as of September 13th. Our total enrollment is 1,884 students. The elementary has 681, middle school has 656, and high school has 547. Our budget was set at 1,874, so we're in good shape.
Good deal.
Next for your review is the withdrawal spreadsheet. Okay, the next paper that I have is the personnel report that we'll need for you to approve. Teresa Alexander has been hired as the certified nursing assistant to Judy Reeves, and she will work part-time to assist her.
We just need two more.
Yes.
Okay, that does need approval. Do I hear a motion? Or is there any discussion first? I don't know if everybody's aware, the nurses are basically overloaded as can be. So we're trying to bring in folks to support them and do everything that we need to do properly. So we're looking for 3 positions, 1 for each campus. Tough to find people right now.
I make a motion that we accept the personnel report as presented.
Second.
Motion to second. All those in favor?
Aye.
All those opposed? Motion carries unanimously.
Thank you.
Is that it?
Some important calendar dates.
Okay.
One that may not be on your paper. This Thursday, September 23rd from 4 to 7, we are having a vaccination clinic here at the high school where parents and students can receive the COVID-19 vaccine and or the flu shot. So that will be this Thursday from 4 to 7 in the parking lot. I believe it's just the parking lot.
Okay.
Okay. September 25th, we have our board strategic planning from 9 a.m. to 12. Following that, at 12 o'clock, we will have a special board meeting to discuss our remote learning plan that the state is requiring all schools to have from Senate Bill 654. This is not to be confused with last year's remote learning option. Just wanted to make that one clear. There's a copy of the guidance from the Office of Charter Schools in your packet. And that's all I have for you.
Great, thank you.
Thank you.
Six C, Enrichment Committee report.
No report currently. The Enrichment Committee will meet on Tuesday, October the 5th.
Thank you very much for taking over that committee, Ms. Largent. 6D, Athletics Committee.
We don't have a report at this time. We were supposed to meet yesterday, but it had to cancel. So we will reschedule.
Okay. 6C, Facilities Committee, Ms. Malden.
Yeah, just a couple of quick updates. We still are on track for the end of October completion of the weight room here at the high school campus. There has been some discussion to maybe add a third garage door and like another pad for them to be able to work out outside, but there's a meeting tomorrow for that, so we'll have more information after that. And then also on the middle school campus, we did have some issues with some water intrusion in the 8th grade mobile units, but those are in the process. There has been some work done already, and then we're waiting to get quotes on finishing that up, so it'll be done soon.
Yeah, keeping up with those mobile units is rough when water starts getting involved.
Yes, there's all kinds of ways for it to get in.
Thank you. All right, we covered 6F. The next board meeting is October 19th, 2021, unless someone has any new business. No, we stand adjourned. Thank you.